Hello, my name is Ben Babcock. I'm currently a student in Columbia College's RN to BSN program. Today we're going to be doing my health assessment video. I've had a patient already in the room getting ready. I've already gathered all of the supplies that I need, and so let's get started.
Hello.
Hi, how are you?
Good, how are you?
Pretty good. My name is Ben. I'm going to be your nurse today. Today we're just going to be doing a head-to-toe assessment. This is Miss Ali. We have agreed to be called each other. Yeah, let's go ahead and get started. Really quick for your safety and mine, I'm going to wash my hands. At this point, if this wasn't a video, I'd close the curtain to provide for her privacy and make sure her door was closed. So, Miss Ali, if it's okay with you, I'm going to have to touch you during this process. Do you have any issues with that?
Nope, that's okay.
Perfect. First thing we're going to take a look at is just her skin in general. We're looking at her skin integrity, the color, the temperature. Notice any rashes, lesions, any type of swelling anywhere. From just this perspective, her color looks normal for her ethnicity. Temperature is warm. Not cool, not clammy, and no visible lesions or rashes at this point. As we assess the other body systems, we'll continue to keep skin in mind. Next thing I'm going to look at is her hair. If you could look down for me, please. Looking at, feeling the texture of her hair. It's not greasy, it's not oily, it's soft. No visible rashes on her scalp. Everything looks good there. You can look up again. No, hair looks well kept. No issues with hygiene. Now I'm going to look at your face for a little bit. I'm just going to kind of study it. It's symmetrical. Again, no open skin sores. No color looks good. Temperature feels good. Not cool, not clammy. No rashes are visible. We probably call her skull normal cephalic. Hair is brown, soft, and clean. Now I'm going to take a look at your eyes, okay? First things I want to do is I want to take a look at her pupil reactivity. So I'm going to shine a bright light in your eye, okay? As we look at this one, we also look at the other one. They do accommodate. Pupils are equal and reactive. If I can have you look up for me. Here I'm looking at her conjunctiva and her vasculature. Everything looks good there. Also just kind of looking at her eyes, we're going to look at the sclera, the iris, look at the size of the eyes. Nothing looks too out of place. No exthalbulbs, I can never say that word. No edema, no conjunctiva or anything like that. Or conjunctivitis, sorry. I know that Miss Ali already wears contacts, so I already know her need for glasses. I don't have a Snellen chart. If I did at this point, we could do the visual acuity test where we would put the Snellen chart about approximately 20 feet away and see how far down the Snellen chart she could read to give us a rough estimate of what her vision is like. We've already looked at the conjunctiva. The eyebrows look full and good. No issues there. Eyelashes, again, no matting, no mascara is well put on. Hygiene is done well. Since she is wearing contacts, I'm not going to test her corneal reflexes. If I wanted to, I could take a cotton tip applicator, poke her in the eye, for lack of a better term, to see if she blinks. You can also tell she blinks because I get close enough and she closes her eyes. We're going to check accommodation and convergence. We already checked accommodation when I shine the light in her eye. Her other people did dilate, not as much as the sign with the light in, but it did. Now I'm going to have her follow my pen light. Eyes do converge. We're also going to check the cardinal motions. Just following my light, looking great. Extraocular movements are great. Fantastic. Now we're going to check for her visual fields. Tell me which fingers you see first.
Left.
Okay, and then let me know when you see the other one.
Right. Or yes.
One more time.
I see them.
Perfect.
Okay.
Next, we're going to go on to the ears. So if you could look to your left for me. Thank you. Not go directions. Right now I'm just inspecting the outer ear. Everything looks pretty good there. No obvious signs of infection or inflammation. I'm going to take a look inside her ear canal and her at her tympanic membrane. So if you can look that way for me. After you push past the hair, you're looking at the tympanic membrane, looking for any signs of obvious infection or earwax buildup. Sorry. Everything looks good in that ear. Can you look that way for me again? Starting with the outer ear, looking. Everything looks good. We'll get you a clean one of those guys for your other ear, just in case. All right. Again, everything looks good. There's a little bit of cerumen, but nothing overly production or anything like that. No infection looking. Everything looks pretty good. So, at this point, we're going to have you close one nostril and breathe through the other side for me. And then switch. Both nares are patent. A little bit of allergy, sounds like maybe some of the cold weather, but nothing out of the ordinary. Now, if you could open your mouth for me like this. Right now, I'm taking a look at her mucous membranes. Everything looks pink and moist, looking good. No obvious signs of infection or maltreatment or poor hygiene. Now, if you can smile big for me. Again, teeth look good. No obvious missing teeth. Everything's matching her chart for her dentition. No obvious caries. And she does not wear dentures. All right, so now we're going to palpate the carotid pulses while she's in this position. We don't want to do these at the same time because that could choke off blood to her brain, and that would be bad. Carotid pulses are strong and equal. We're going to look at some tracheal alignment. Again, everything looks nice and aligned. No issues there. We're also going to feel for the thyroid gland. Don't feel any swollen nodes or lobes. Everything feels good there. And then if you could swallow for me. Perfect. For the assessment, we're going to move on to the respiratory assessment. To get a better visual of her chest, I'm going to let her know, hey, I'm going to take the gown down a little bit. That way I can see the symmetrical movement and if she's having any difficulty breathing, any labored movement, any accessory use. At this point, you can see she's not having any difficulty breathing. No accessory use is being used, or no accessory muscles are being used. And yeah, everything looks good there. We're going to start with palpation. So I'm going to feel for a type of crepitus. Kind of feels like Rice Krispie treats. Let me let her know she has any sub-Q air. Also feeling for a type of tenderness. Let me know if any of this hurts.
Okay. It does not.
Okay, perfect. At this point, I'm going to move to the back side. You stay just like that.
Okay.
Oh, thank you for moving your hair. Again, I'm going to start with just some tenderness, or some palpation for any tenderness, any type of crepitus. Let me know if you feel any. All right, everything looks good there. Then we're going to start with percussion. With percussion, we're just looking for, or listening for the type of tones we hear. You want to hear tympanic noises over the lungs. If you start hearing dull sounds, it could be a sign that there's fluid in the lungs or some type of swelling or infection. Everything sounds good. While I'm back here, I'm going to go ahead and listen. At this point, I just want you to do a bunch of breaths with your mouth open, nice and deep for me, okay?
Okay.
Go ahead. Again. 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 We're going to also listen to the lateral side, comparing each side to each other. All right, you can breathe normally. Everything sounds nice and equal, clear, no sounds of wheezes or crackles or any type of abnormal breath sounds. Now we're going to listen and percuss the front. Again, just big deep breaths into your mouth for me, okay? All right. Everything sounds good there. One thing I forgot to do when I was examining the face was kind of check for any type of swollen lymph nodes. I'm going to go ahead and do that now. Just following the lymph tract down through the jaw and down the neck. Feeling for any type of swollen lymph. Nothing seems swollen. Looking good there. At this point, I'm going to go ahead and have Ali lay back in the bed. Get into a comfortable position so I can start examining the cardiovascular system. First thing we're going to do again is inspection of the anterior chest. We already kind of did that with a respiratory assessment. There's no reason to do it again. Palpate it. We just palpated it for the respiratory assessment. I don't need to palpate it again. One thing you will notice when assessing the cardiovascular area is you're going to feel the point of max impulse or the apical pulse. It's right down here. You can feel that for get your pulse rate. It's the best way to get your pulse rate because it's right off of the heart. You can also palpate for the right ventricle area. If feeling for any type of thrills or bruise, you also want to palpate the two pulmonic areas and the aortic area. Again, not feeling any type of thrills or bruise. Everything's feeling good and normal. She does have the apical pulse down here, and you can actually even feel her right ventricular pulse. At this point, we're going to auscultate all 5 precordial areas. I like to start with the aortic area, which is just at the second intercostal space of the right sternal border. Find my spot. You want to listen with both your diaphragm and your belt. At this point, S2 should be louder. After you listen there a couple beats, you want to come over to the pulmonic area. This is at the left sternal border, the second intercostal space. Listen with the diaphragm and the bell. And then you want to move kind of down the sternal border on the left side. You're going to be in what some people call Erb's point, or the second pulmonic area. Listen with diaphragm and with bell. We're going to go down to the tricuspid area. During the both pulmonic areas, you're going to hear S2 a little bit louder. The second area, you might hear a little more equal S1, S2. In the tricuspid area, you're definitely going to hear S1 a little louder. Listen with both diaphragm and bell. Last place we're going to listen to on the heart is the mitral area. You should definitely hear S1 louder. Again, listen with diaphragm and bell. All right, everything sounds normal. No murmurs or any type of stenosis heard. And at this point, we're going to go ahead and cover her back up. Thank you. Maybe. There we are. If I can go ahead and have you put your hands out for me. Nope, just towards me.
Nope.
Right now, we're just looking at capillary refill. You want to kind of make sure it's equal in both hands. Less than 3 seconds. Looking great. Going to feel some radial pulses. You want to do them bilateral at the same time. That way you can feel if they're equal. They are. They're both strong and weak. They're strong and equal. And if you can squeeze my hands as hard as you can, perfect. Everything looks good there. So, we're going to do all of our range of motion and extremities once we're out of bed. Since we're still in the bed, I'm going to go ahead and start assessing the stomach. To keep your patient covered in privacy, you're going to go ahead and cover up her legs and then pull her gown up a little bit so I can get to the abdomen. First thing you want to do with abdomen is inspect. Thank you. Abdomen looks flat, no obesity, no scars, no skin looks good, it's intact, no feels warm, color is normal. Next thing with the GI system is you want to auscultate. So we're going to listen for bowel sounds in all 4 quadrants. You always want to also tape before you palpate, because palpation can lead to increased bowel sounds. Bowel sounds are normal, active, no issues there. Good clicks and gurgles. All right, now I'm just going to ask you a series of questions. We can go ahead and cover you back up. It's always good to keep your patient covered. All right, Miss Sally, how have you felt about your appetite lately?
It's normal.
Normal. Have you had any changes in body weight over the last few months or anything like that?
Nope.
Since your last exam? How was your last bowel movement?
Normal, like
Any type of nausea or vomiting, diarrhea, constipation?
Nope.
Perfect. Have you had any issues with any type of incontinence or anything like that?
No.
All right. Oops. One thing I forgot to do while the abdomen was exposed was palpation. At this point, at this point, you're just feeling for any type of tenderness. Let me know if any of that hurts.
Nope.
Any rebound tenderness anywhere?
Nope.
I'm going to do light and deep palpation on the abdomen. All right, everything feels good. Now we're covered back up. I have a couple questions about your genitourinary area. Have you had any issues, urinating, any burning, any discomfort?
Nope.
What was the last, color characteristics of your urine?
Yellow, clear.
Perfect. All righty. Before we start doing any type of musculoskeletal exam while she's still in the bed, I'm going to go ahead and check her lower pulses and then also her pushes and pulls on her feet. So first we're going to start with the Dorsalis Pedal pulse. Pulses are strong and equal. Then we're going to move to the Dorsalis, or the posterior tibial pulse. Again, strong and equal. All right, Miss Sally, can you pull up on your toes? Perfect. Now push down like you push down the gas. Perfect. We're also going to do a quick assessment of the lower extremities, feeling for muscle tone, quality, feeling for any type of contractures or fasciculations. Everything feels good there. Any tenderness in any of these areas?
Nope.
Perfect. All right, we're going to go ahead and put some socks back on you. Now we can get out of bed and we can assess some of your musculoskeletal movements. All righty. Go ahead and get you covered up back here.
Thanks.
Thank you. All right, first thing I want to take a look at, I'm going to take a look at some of just her normal movements. Go ahead and put your arm out for me. Pull up against your elbows like so, looking good, push out. Elbow extension and flexion look normal. Now put your hands at your side. Now pull your arms back like this. It's hyperextension of the shoulder. Looks good there. All right, now go ahead and raise them straight up. That is just flexion of the shoulder muscle looking good. Put them like this. We're gonna go out. That is abduction. Come back in. Adduction, moving her shoulders just fine. Everything looks good there. Now if you can go like this again for me, and then rotate. We're doing pronation, or sorry, supination and pronation. And then if you can move your arms like that for me, circumduction. All right, now we're gonna take a look at the hips. You can push your leg straight out for me, and then the other leg, hip flexion. And then, all right, we're also going to look at hip adduction and abduction. So one leg out to the side, other leg out to the side, cross over the middle, cross over the other way. Perfect, perfect. And then we're going to do external rotation, internal rotation, external or internal rotation, external rotation. All right, moving just fine. Now, if you don't mind taking just a couple steps that way and then a couple steps back. This point, we're just kind of looking at her gait. Want to make sure she's not weak or shuffling her feet. She's a normal gait for a young lady like herself. Everything looking good there. All right, if you want to go ahead and get back into the bed. Oh, not like that, just like that for me, thank you. Now we're going to check her knee flexion extension, so push up against my arms, perfect, pull back, looking good. All righty, everything looks good. If you want to go ahead and lay back in the bed, we'll get you comfortable. Get her nice and covered up so she's nice and toasty. Is there anything else I can get for you at this moment, Miss Alvin?
No, I'm okay.
All right, so at this point I'm going to go ahead and gather up my supplies. I'm going to do a safety check of the room, make sure there's nothing left in here that she could use to either hurt herself or cause any issues if she needs to get out of bed, like tripping hazards. Everything looks good there. We will unscreen the area, which we already are unscreened for the video's sake, and then I wash my hands. Thank you for participating in my hip toe assessment.
Thank you for doing it.